Why is postprandial glycemic control important? In healthy people, high blood sugar after eating is a normal phenomenon, but for people with type 2 diabetes, blood glucose levels spiral uphill and continue to recur, which will trigger oxidative reactions that cause damage. Vessel walls, creating a precondition for the formation of atherosclerotic plaques. First, a blockage in an artery that supplies blood to the heart increases the risk of conditions such as angina, heart attack, or stroke. High blood sugar also damages the capillaries that supply blood to the brain, impeding circulation, resulting in patients finding it difficult to concentrate or think clearly. First, on the contrary, if the blood sugar level drops suddenly, the person may face symptoms such as shaking, dizziness, or even fainting or coma. Therefore, in order to reduce the rate of dangerous complications, it is essential to control blood sugar after eating. 2. How do you know if your blood sugar is not stable after eating? To be able to monitor blood glucose after meals accurately, the American Diabetes Association, ADA, recommends patients should measure blood glucose before meals and exactly 2 hours after eating. You can measure your blood sugar at home with a personal blood glucose meter or at the nearest medical facility. 3. You should keep this routine for about a week or so. Most importantly, record the time taken and blood sugar levels. In addition to these two factors, make a note of anything that affects your postprandial glycemic index, such as the use of drugs, workout plan, the serving size, the food consumed, as well as the amount of carbohydrates consumed in each meal. 4. So what is a safe blood glucose level after eating? According to the ADA, the general goal is that blood sugar should be below 180 mg/dl, 10 mol/L. In case the results obtained after 2 hours of eating exceed the allowable threshold, you should consult your doctor about the solution. Absolutely avoid increasing the dose or changing the medication on your own. 3, 5, 6. Effective ways to stabilize blood sugar after eating. Measures to stabilize blood sugar. If you find that your postprandial blood sugar is above a safe level, try these tips right away. 1. Drink a lot of water to avoid affecting blood sugar after eating. When dehydrated, the body produces a hormone called vasopressin that stimulates the kidneys to retain water and prompts the liver to release stored sugar into the bloodstream. To prevent this from happening, drink plenty of water during the day, especially when the weather is hot or after a tiring workout. Prioritize filtered water or unsweetened herbal tea to avoid affecting blood sugar. 6. 2. Choose foods with a low glycemic index. Many people are afraid of a spike in blood sugar after eating, so they abstain, even completely eliminating starchy foods from the menu. This is very wrong, because the general rule is that a nutritious diet must always include all 4 elements: sugar, protein, fat, fiber. 6. If you are afraid of high blood sugar, prioritize foods with a low glycemic index, GI. This heading includes mainly vegetables, tubers, whole grains, and beans. They are considered a good source of vitamins and minerals for the body, especially soluble fiber that helps create a feeling of fullness for a long time, and slows down the conversion of carbohydrates into sugar. 7. In addition, patients should also limit the consumption of cakes and sugary drinks. At the same time, divide your daily meals. Do not eat too much in one meal to keep blood glucose levels stable. 6. 3. Don't skip breakfast. With the current cycle of work and life, many patients have forgotten the most important meal of the day and choose to make up for lunch. This is very easy to cause large fluctuations in blood sugar, and at the same time affects the effectiveness of insulin use during the day. 8. In case you are too busy or feel too tired to eat rice, you can have breakfast with a special glass of milk for diabetics. One thing of interest is that this milk is used to replace a snack or main meal, not for the purpose of drinking more as many people think. Accordingly, people with type 2 diabetes should choose milk that is full of essential nutrients. In particular, A few types on the market today have a slow-release carbohydrate system that helps limit the excessive rise in blood sugar after eating for 4 hours. 4. Light exercise to control blood sugar after eating. In addition to a 30-minute daily exercise plan, people with type 2 diabetes should try to exercise gently after meals for about 15 minutes. The enhanced physical activity reduces blood flow to the bowel, increase circulation to organs, which helps the absorption of sugar into the blood slower. In addition, blood sugar is also taken less by the muscles. 7. 5. Moderate activities. Moderate activity to stabilize blood sugar after eating. To stabilize the glycemic index after eating, you should give up the following bad habits. 9. Drinking alcohol and beer. Long-term use of alcohol also affects the effectiveness of insulin use, a huge problem for people with type 2 diabetes. Sleep less, sleep not deeply. Research shows that people who sleep less than 4 hours a day have a higher risk of insulin resistance and hyperglycemia. 6. Using medicine to control blood sugar after eating. If exercise, lifestyle changes, and diet still don't stabilize your blood sugar after eating, your doctor may consider changing your medication. The most important thing is that you must follow the prescription to avoid unwanted side effects. 10.